Is that the right approach to try and put this on an accelerated course to bring some form of certainty to voters this year?
Well, everybody is wanting to get vaccines developed and tested as quickly as possible. But we need to know that they are safe, we need to know that they're effective, and we need really to know how long they're going to be effective for. And you can't answer those questions overnight, and you can't answer them without enough people having been studied. Now, just because you go fast doesn't mean that you don't go securely. As long as there are enough people in the studies, and some of the US studies are talking about 30,000 people, well, that's the size of studies normally for vaccines. The fact that you've done it quickly doesn't mean that you've cut corners. But if you do cut corners and you don't have enough people in your study to show safety, and you don't have enough people to show effectiveness, then I think you're in a dangerous position. And public trust could be lost because people would worry that the vaccine they're being given has not been tested for safety and has not been tested for effectiveness.
Professor, on that point, the polls suggest that the number of people who are nervous about taking a vaccine, given the speed with which this process has progressed, has been increasing in both the United States and in Britain and surely in other parts of the world as well. What percentage of the population needs to be vaccinated in order for the vaccine to have its desired effect?
Well, there are two things here. The first is that you want to protect the people who are most vulnerable. And that's going to be the older people and people with medical risk conditions. And you want to get as many of those as possible to protect them individually. The second issue is, when do we have enough people protected to stop the virus spreading? That's more difficult because we don't know what the effectiveness of the vaccine is, and then we've got to know how many people are going to be protected. If you have a vaccine that's 80% effective, and you only vaccinate 50% of the population, well, you're only going to have 40% protected, and that won't be enough to stop transmission. So the older people and the people with medical risk conditions, I think, will be easier to vaccinate. I worry much more about the younger people who we would need to vaccinate to stop transmission, who already don't wear face masks, who ignore social distancing, and I think that they will be much more difficult to persuade. If we want to stop transmission, to make everybody safe, we have to vaccinate large numbers of people.